Welcome to this explainer. Okay, today we're diving into something that is an absolute game changer if you're in respiratory medicine. We're talking about the GOLD and GINA 2026 interactive web app. Look, if you've ever felt completely overwhelmed trying to translate, a 200-page medical update into real-time actionable clarity for the patient sitting right across from you, well, you're in exactly the right place.
Seriously, picture your typical bustling clinical shift. You've got a patient waiting, the clock is ticking. How fast can you actually take all those complex, newly updated 2026 medical guidelines and, accurately put them to use? It's a massive challenge, right? Memorizing every single new drug pathway, the shifting biomarker thresholds, the updated staging criteria, it's not just tough, it literally eats up precious time that you should be spending actually talking with your patient. And that right there, that is exactly the headache this application is built to cure.
So here's how we're going to break this down today. 1. Navigating the 2026 guidelines. 2. Introducing the app itself. 3. GINA 2026 for asthma. 4. GOLD 2026 for COPD. And finally, number 5, we'll cover its purpose and limits.
All right, let's kick things off with Section 1, Navigating the 2026 Respiratory Guidelines. Because let's face it, the sheer volume of updates in the 2026 guidelines creates a very real problem for pulmonologists needing fast answers. We're talking about extensive changes, constant additions, totally tweaked patient groupings, and entirely new classes of drugs being rolled out by both GOLD for COPD and GINA for asthma. Expecting any professional to just instantly recall and cross-reference all of this data from some massive PDF at 3 a.m. while actively managing a patient, it's basically a recipe for burnout. It's just not realistic.
Which brings us to Section 2. Introducing the interactive app.
So what's the big deal with this tool? Well, it's an interactive clinical staging and management calculator, and here is the key part. It's based strictly on official guidelines. It's essentially a direct translation tool for clinicians. It doesn't invent any new rules. No, it just takes the official 2026 strategy reports and turns them into this highly responsive, real-time interface. In fact, its creator, Dr. Zakalis, noted that after doing a really deep dive, this specific dual-function web app seems to be totally unique in its class right now. There's really nothing else quite like it.
Let's quickly walk through what makes this thing tick. First off, it is built exclusively for healthcare professionals, specifically pulmonologists, and crucially, the interface features full bilingual support, both English and Greek. This is fantastic because it broadens the accessibility, letting clinicians work in whatever language they or their patients are most comfortable with. At its core, this app gives you rapid assessment of lung function, evaluates symptom control, calculates exacerbation risks, and finally, boom, spits out evidence-based pharmacotherapy guidance, literally everything you need all in one centralized spot. Moving right along to Section 3, GINA 2026 Asthma Assessment.
Now, the interface here is designed around 4 beautifully simple steps. You're not going to be digging through complex nested menus. Step 1, the user simply selects their preferred treatment pathway. Step 2, you literally just slide a bar to input the patient's post-bronchodilator FEV1 percentage from their spirometry. Step 3, check off their symptom control over the past 4 weeks. And Step 4, punch in their exacerbation history along with specific biomarkers like blood eosinophils and FeNO. And that's it. Real-time, evidence-based recommendations pop up immediately. And when you're handling that symptom control in Step 3, it is so seamless. The clinician just checks little boxes for daytime symptoms, night waking, reliever use, and activity limitation. Instantly, the app takes those inputs and cross-references them against the GINA standard. 0 criteria met, the patient is well controlled. 1 to 2, they're partly controlled. 3 to 4, flags them right away as uncontrolled. It completely eliminates the mental math for you.
Okay, so once those symptoms are tracked, the app clearly splits the treatment pathways based on what you chose back in Step 1. It perfectly mirrors the GINA 2026 preference for Track 1, which, as you know, relies on ICS formoterol as an anti-inflammatory reliever, or AIR. Now, Track 2 is still there as an alternative, using a short-acting beta agonist or ICS-SABA alongside a maintenance inhaler. But seeing these two tracks laid out side by side like this, it's brilliant for preventing any kind of regimen confusion.
Now, glancing at the output, you're going to frequently see the abbreviation AMART pop up, especially when you're in Steps 3 through 5 of Track 1. The app defines this right there for you, maintenance and reliever therapy. This is a massive, massive focus for modern asthma care. And why does this matter so much? Well, simplifying a patient's regimen down to a single inhaler, using it for both their daily maintenance and as-needed symptom relief, it just drastically improves medication adherence. It's a real win for the patient.
But what happens if a patient hits Step 5?
severe asthma. This is where the app truly flexes its muscles as a translator. Let's say the clinician inputs the raw biomarker numbers, maybe an eosinophil count of 200 and a FeNO of 28. The app instantly analyzes that raw data against the 2026 thresholds, identifies high type 2 inflammation, and then actively suggests targeted add-on biologics. It literally points you toward therapies like anti-IgE, anti-IL-5, or anti-TSLP. It bridges that frustrating gap between raw lab results and advanced therapeutic options absolutely flawlessly.
All right, let's pivot to Section 4, GOLD 2026, COPD staging.
Much like the asthma side, the GOLD 2026 tool breaks everything down into 4 super clean steps. First, you set the FEV1 percentage on the slider. Second, you assess the patient's symptoms using either the MMRC dyspnea grade or the CAT score slider. Third, you tally up their moderate and severe hospitalized exacerbations over the last 12 months. And finally, you input their blood eosinophils to evaluate how they might respond to inhaled corticosteroids. Simple, fast, effective.
And the visual feedback is great. As soon as you adjust that FEV1 slider, the app visually calculates the airflow limitation severity. It locks the patient right into a strict spirometric grade. So, greater than 80%, that's GOLD 1, mild. 50 to 79% drops them into GOLD 2, moderate. 30 to 49% is GOLD 3, severe. And anything under 30% gets flagged as GOLD 4, very severe. You get this immediate, completely unmissable snapshot of their lung impairment.
From there, the app takes that spirometry data and combines it with the patient's symptoms and exacerbation history to drop them right into the GOLD ABE classification. So, say they have low symptoms and very few exacerbations, boom, they're Group A, and the app outputs a recommendation for a single bronchodilator. But if they've had a hospitalized exacerbation, they shoot straight into Group E, and the app instantly updates to suggest a LABA plus LAMA combo. It takes all these intersecond variables and just distills them into a single, crystal-clear clinical direction.
Which brings us to our final part, Section 5, Educational Purpose and Limits.
Now, right there on the site, there is a very clear disclaimer we need to talk about. It states, all applications are offered for educational purposes only and certainly cannot replace a medical visit, examination, or diagnosis. It also says they can't be used to determine actual pharmaceutical treatment. The absolute key takeaway here, this tool is a brilliant educational aid. It's an incredible rapid reference guide that organizes complex data beautifully. But at the end of the day, it absolutely relies on the final clinical judgment of the attending physician. And I think that leaves us with a really fascinating question to ponder. As medical guidelines become increasingly complex and layered with all these new biological therapies, how will interactive, algorithm-driven educational tools like this one reshape the future standard of respiratory care? I mean, think about it. If an app like this can save a pulmonologist even 3 minutes of frantic guideline checking per patient, imagine the compounding positive effect that has on face-to-face bedside care over an entire career. It's a pretty exciting glimpse into the future of structured medical learning. Well, thanks so much for diving into this explainer with me today. Keep exploring, and as always, stay curious.